we as a country had fallen behind by 5 years in life expectancy compared to other high-income countries. And you alluded to this in your introduction, which means, I often tell audiences, it means that you decided to die 5 years earlier than you had to. And I always ask audiences, well, raise your hand if you made the decision. And nobody raised their hand. Nobody decided that. But effectively we did. Effectively we did because we as a society have not been willing to make the investments in the structures that make us healthy throughout our life.
Greetings, I'm Yvonne, staff for Science for the Public, and I welcome you to our Contemporary Science Issues and Innovations program, presented today as a WGBH Forum Network webinar. In the US, when we talk about health, we focus on health care. Compared to other peer nations, we spend much more on health care, but rank near the bottom in actual health. Our guest today will explain that good health depends substantially on social, environmental, and economic factors promoted by the field of public health. Sandro Galea is an international leader in public health and epidemiology. Dr. Galea is the Dean and Robert A. Knox Professor at Boston University School of Public Health. Dr. Galea has received numerous awards for his work and is the author of influential books, one of which, and the most recent, is Within Reason, and we will include that today in our discussion. Dr. Galea, welcome, and thank you very much for joining us today.
Thank you, Yvonne, for having me. It's always great to talk to you.
And please start us with a clarification about public health. What is that field? What are the concerns there, please?
Yeah, I'll start with what exactly public health is, because I do feel like there's misconception about this. The way I see it is public health is about health. And I'm doing this with my arms, because if you think of health as a large area, medicine or healthcare is a small area within that. So health is what we do as a society to keep us all healthy. Medicine is what we do to restore us to health once we're already sick. So let me use a metaphor. So by way of metaphor, if you think about a car, forget about the human body, let's think about a car, right? The car's health is determined by the roads it drives on, that there are no potholes, that there are no cars driving into it, that its tires are robust, that it has gasoline in the tank, or it's charged up if it's an electric car, right? That's what the car's health is determined by. Those are the factors that actually keep a car running. If a car breaks down, then you need to take it to the mechanic. And the mechanic is healthcare and medicine. Now, when I give that metaphor, I think anybody listening will recognize that when you have a car, you don't want to spend all your time at the mechanic. You actually want to use your car. You want to go out on the road. You want to get groceries, or you want to go on road trips, whatever you do with your car, right? Similarly with health, we don't want to spend our time at a doctor. What matters to us really is staying healthy. And staying healthy means the air we breathe, the water we drink, the food we eat, opportunities to exercise, being safe from violence, having a livable wage so that we actually we can have the resources that generate health, having education so that actually we can self-actualize. Those are the forces that generate health. Medicine and healthcare are there to make us healthy again if we get sick. And they're important. I never want to make an or argument. This is an and argument. But health is much bigger than healthcare. And this is a misconception all the time. Sometimes I challenge people to say, start a conversation at dinner if you have guests over about health. And you can say, I heard WGBH on science, and I heard this conversation about health. Just get a conversation going and give it a few minutes. And within 5 minutes, you'll find that someone will use the word healthcare instead of health. And the two are different. And my encouragement is that we keep them separate.
Thank you for that. And so that field of public health is extremely important. And maybe we don't hear so much about that background, how important that background is in this country. But can you give us examples of nations that do have good public health, as you have just described, that background, that and how that correlates with health?
Yeah, I think I'm always reluctant to give a particular nation because I do think that different nations have different approaches that are complementary and to the national culture and the national context. But there are nations that invest much more than we do in the social safety net, in making sure that everybody has a livable wage, and making sure that their streets are safer, and making sure that there's clean air and drinkable water. There are nations that invest much more than we do in the actual mechanics of disease detection and surveillance and the data that go towards public health. There are nations that do a better job than we do in making sure that infants have a safe early childhood so that they actually can live a long, healthy life. And these are all elements that one wants to achieve to generate health. In the context of the pandemic, we spoke a lot about public health. And public health all of a sudden became something that we were all talking about, which was all to the good. But we focused on one very specific aspect of public health, which is the detection of an infectious disease and the detection, mitigation, control of the infectious disease, which is all very important. But as I wrote about we're going to talk about my Within Reason book, but my book before this one was called The Contagion Next Time. Mm-hmm. In that book, I talked about how the problem in COVID wasn't as much COVID, the virus, but it was about the world around us, that we were living in a world where a lot of people could not protect themselves from the virus. We're living in a world where we did not have active surveillance systems. We're living in a world where people did not have enough income to stay at home and isolate themselves. That is the world we're living in, and that's what resulted in the consequences of the pandemic.
Yes, thank you for that, and we'll come back to that too. I think in a little bit when we're focused on the new book as well. But can we now switch to the issue of health care a little bit? We have so much health. We have so many health issues in this country. You mentioned one, like infants. Really, the infant mortality is very high in this country. A lot of other concerns. What is our problem there that we are not healthy?
Well, our problem is everything, and by that I don't mean to be glib. What I mean is that when you realize that health is generated by the world around us, that whether or not, Yvonne, you and I are healthy, if we're sick, we go to the doctor, okay? So let's accept that, put that to the side. But to keep us healthy on an ongoing basis, we need to make sure that we have access to nutritious food. We have access to food that is nutrient rich and not overly calorific, right? We need to make sure that the air we're breathing is safe. We need to make sure that when you go out of the room you're in, I go out of the room I'm in, we're not in danger of being exposed to violence. We need to make sure that we have enough resources to be in a safe environment, in a warm environment. You and I are both in Boston, where it's very cold outside today, but we're actually able to be in a warm environment, protected from the elements. These are the elements that make us healthy. And these are the elements that we fall short on for whole populations, in particular for particular groups within those populations.
Mm-hmm. Right. Then you've pointed out a number of other things in a number of your books too along these lines. But may I ask about just on diet alone? We have the consequences of poor diets, like diabetes too, all kinds of diseases that are the result of having a lousy diet all your life. That situation, does that exist all over the world?
It does.
For concern.
Well, the human physiology is the human physiology. Like, we as carbon-based life forms, as humans, are what makes us sick. It's the same whether you live in the United States, whether you live in Denmark, whether you live in South Africa, whether you live in Vietnam. I mean, the physiology is the same. Disease ultimately happens within us. It's physiologic. So these things are all the same. They're different. As I said, different parts of the world have different limitations in terms of the forces that generate health. For example, we are outliers, negative outliers as a country in terms of risk of exposure to gun violence. There are very few countries that even come close to our danger being exposed to gun violence. We are negative outliers in the context of the proportions of our population that are left behind. We have health haves, health have-nots that mirrors resource have and resource have-nots. These are elements on which we as a country have fallen behind, and those reflect in our health outcomes. Before COVID, leaving COVID aside, we as a country had fallen behind by 5 years in life expectancy compared to other high-income countries. And you alluded to this in your introduction, which means, I often tell audiences, it means that you decided to die 5 years earlier than you had to. And I always ask audiences, well, raise your hand if you made the decision. And nobody raised their hand. Nobody decided that. But effectively, we did. Effectively, we did because we as a society have not been willing to make the investments in the structures that make us healthy throughout our life.
I understand that, but there's another area in here in that there is no intrusion sometimes on the amount of junk food that is available, for instance, and that is kind of imposed on people. Even it used to be, at least in schools, they'd have really this hyper processed food. So there's the food, and that leads to a lot of problems right there. Other things that you have talked about in your books would be things like the alcoholism, I guess, the depression, all of these other factors. Nobody is regulating anything, right? To put a stop to that, to make that. You're saying we have to do something, but somebody might need to intervene here.
Well, let me perhaps modify that a little bit, if I may. I mean, I do think we regulate things all the time. I mean, the truth is we do. I'll go back to my car analogy. You get into your car, you don't think twice about putting on a seatbelt. You don't think twice about the fact that you have shatterproof glass. You don't think twice about the fact that the car is made of material that actually creates a crumple zone around the driver. You don't think twice about the fact that we have laws against drunk driving. You don't think twice about the fact that there's a shoulder on the side of the road where you can pull over safely. So these are all contexts that we have built to keep us safe when we drive. Now, coming back to foods, what you said specifically, we actually do regulate foods quite a bit. We inspect foods. We have guidelines about foods. We have guidelines about school lunches. We have guidelines about nutritional expectation of particular foods. So public health is all about finding the right balance, finding the balance where we can actually introduce enough safeguards around us to create a world that's healthy around us without doing that so much that people reject us, that people reject what we do. And that's why my newest book, the title is Within Reason. It's how to do it within reason. And let me keep extending this metaphor I'm using. We as a society mandate wearing a helmet when you drive a motorbike, right? So we've looked at the data and said, this is really risky. It's really risky to ride a motorbike. And there's a high risk of, if you fall, you'll die if you don't wear a helmet. So if you're going to wear a motorbike, we make it part of the law that you have to wear a helmet. Now, we also know that if you were to wear a helmet every time you drive your car, you're probably going to be safer. But we don't require that. Now, why not? It's because we have made the assessment of the risks and the benefits, and we decide where to draw the line between when we think something is too harmful for us. As a result, we're regulated, or when something we're willing to accept the risk. So the wisdom in public health is balancing those trade-offs, looking at the science, seeing what the science tells us, and coming up with the right place where we introduce regulation, introduce guardrails, introduce restrictions, but in a way that they are acceptable to the population, and that populations are willing to embrace them because they create then freedom from disease. And it's that wisdom to find the trade-off is that what marks public health.
I'd like to go to the healthcare issue itself now, in terms of how expensive it is in the United States. So not everybody can get the healthcare. In our peer nations, is universal healthcare the rule rather than the exception?
Well, universal healthcare depends what you mean, because it's a very broad term.
I mean, the healthcare for everybody from birth on.
It is certainly the norm that most countries have an expectation that people will have coverage from the healthcare system. Yes. We are one of the few countries that doesn't have that expectation. The truth is, how it's implemented in many different countries is sort of patchy and quite different. But I think the fundamental to your question is universal healthcare a key part of creating this ecosystem that generates health? The answer is yes. Now, I want to be clear, as I said at the beginning, that healthcare is only there for a part, right? If this is all health, healthcare is just a small part of it, and healthcare is there to restore us to health. But having said that, it's an important part of restoring us to health. You know, another metaphor that I've used in my writing, if I may, is that of a full soccer team, you know? So you have a soccer team, you have 11 players who are playing the game. And one of those players is the goalkeeper. The goalkeeper is there to stop the ball from going into the net if it comes at her, right? The other 10 players are the players that move the ball upfield. Now, in order to win the game, you need the players to move the ball upfield. And those players are the ones I'm talking about. Those are safe environment, safe food, nutritious food, safety from violence, having an equitable income, making sure that you live in a society where you have opportunity to exercise. Those are the other players. But the goalie, which is the doctor, also matters, right? If you don't have a goalie, somebody's going to kick the ball into your net from upfield and you won't even notice it. So all of these elements matter.
Right. Also one more thing before we leave that is in terms of regulatory agencies like the EPA and the Environmental Protection Agency, the Federal Food and Drug Administration, those sorts of agencies, are they more effective or just the same in other countries so that, you know, things really get the regulation that they need?
I don't know that one can come up with a blanket answer to that. I think some of these agencies are more and some are less effective in different countries. So I think it is the you know, this country has a very robust administrative state, and a lot of that intersects with politics. A lot of that intersects with political will. A lot of it intersects with the how much a country aligns philosophically with the reach of the administrative infrastructure. So I don't know that we can say that the US is less robust in its administrative structures. I think the larger question is, how effective have we been in shifting the conversation to create the kind of structures that we need to make sure that we are all as healthy as can be for as long as possible?
Yes, I think I didn't perhaps make that clear that in the corporate intrusion in these regulatory agencies is pretty strong in this country. And that's really what I was after with is, are they a little more independent somehow in other advanced economies? The reason that I ask it is this really matters when you have things like the Environmental Protection Agency. We have these toxins being used on crops, and those directly affect the health of people, especially certainly the workers, but people who eat the food and everything else. So I wanted to know if in other nations, do we have a lot of this corporate interference?
I think there is a challenge with commercial forces and how they intersect with our decision making in all countries. Actually, that is something that the world is slowly coming to terms with, and different countries have different sets of safeguards against it. If anybody's interested about that, I see there's been some books put in the chat. I actually published a book called The Commercial Determinants of Health with a couple of colleagues. And we really talk about, you know, commercial determinants are how corporate forces intersect with our environment to generate health. So we talk about that in that book. But you know, recently I've been involved with a group of colleagues, for example, doing a paper about some commercial forces intersecting with nutritional policies in Ecuador. So that is a reality in many countries. And I think we're slowly coming to terms with figuring out how to maintain a vibrant commercial sector that fuels the economy, but at the same time to maintain autonomy and independence of regulatory structures to make sure that the commercial forces that drive the economy work to generate health, not harm health.
I see. Okay. Thank you for that good background. I'd like to shift now to your book. and mine is dog-eared all over the place.
That's wonderful. That's wonderful.
Well, I have several of your books, but the one that you just mentioned, I don't have, and I will try to look into that because that's of interest. But this one, you've been doing a lot of media with this, and thank you for the book. It's come out at a time to address what we went through, especially in the COVID mess. And there are several things. I want to give you plenty of space on this one because it covers quite a lot. But I did want to ask if you would take up some of these problems like the misinformation and disinformation issue, the social media that drove so many of the problems there. But and then liberal and illiberal, though that as you have addressed it here. So what was your major idea in that book, please, to start?
Well, yeah, you've anticipated a lot of the concepts in the book. Thank you. I'm grateful to you for that. And I'm very grateful for the dog earring. It makes me, nothing makes me.
Yes, look at them.
Someone has actually read the book. So the major idea behind the book is this notion of, it's a bit of a, I realize it's a bit of an abstract notion. It's not real liberalism. And
Right.
By liberalism, I don't mean Democrat. I want to be very clear.
Right.
It is a set of values that come from the Enlightenment, from sort of Western European thought, although there are echoes of them in thought from many other parts of the world. I mean, there's a lot of thought, echoes of these thought in other Asian philosophies, etc. But I'm basing it on Western European thought. And liberal thoughts mean grounding what you do in reason,
Yes.
not in ideology. It means observing the natural world to draw empiric observations and to use those empiric observations to inform the policies and the decisions that we make so that we can improve the world gradually. It also means centering at the heart of what we do a motivation to care about the autonomy of the individual, that we care about, and this is something which has echoes in what we call now human rights, that we fundamentally do what we do to the end of improving the well-being of individuals to improve their autonomy. So all of that together is what I think a liberal set of thoughts means. And those in our political spectrum, they sort of are both in the right and in the left, because and we use these words very casually and sometimes not productive. For example, the word libertarian, which is typically associated with comes from this because of the centrality of the individual, the autonomy of the individual. At the same time, the notion of implementing societal reform to improve everybody typically falls on the left in the context of social safety net. So it is concepts from across sides of the political spectrum. Now, I apply this idea to public health, and particularly public health in the context of COVID. And the point I try to make is that public health is, in the context of COVID, sometimes forgot that our goal was to center the individual, that our goal was to create the space for individuals to flourish, and to do that based on data, but combining the data with other inputs to create a world that allowed individuals to flourish. And in part, we forgot about that because we forgot that health is a means to an end. The end that we should care about is creating a world where people can live and flourish. And health is just one means towards that. And when we forget that, we do things that are illiberal, which means they restrict individual autonomy unreasonably, and they restrict the space within which people can act in a way that's not built soundly on reason and logic. So let me use one example. One example that I use in the book is, now that's pretty abstract, I realize. So let me just bring it down to one concrete example. One example I use in the book is the example of restrictions that we imposed for a long time on people being able to see dying loved ones in the context of COVID, where we said, because we're so worried about transmission of COVID, if you have a loved one who's dying, well, you can't see them. You can't give them a goodbye kiss. You can't give them a goodbye hug, because you know what? What really matters is that you don't get COVID. Well, many of us are willing to get COVID to give a dying loved one a goodbye hug and a goodbye kiss, right? So what we did was we mistook the we mistook our goal of creating a world which respects autonomy and dignity of individuals, informed by the science, but to create a world where people can actually realize the values that matter to them, for one that was driven by a narrower ideology, where the only thing that mattered to us was counting COVID cases. And that was a mistake. And that's what I consider illiberal.
Right. And another one, if I may, and there was the issue of children, whether to vaccinate them for this. And I want to follow up on that in a minute. But can you can you explain how you address that here as an example of that illiberal approach?
Yeah. And, the children example is, I mean, there are two children examples. We'll talk about both of them. One of them, and both of them actually, I think, can be looked at in comparison with what other countries did. And you were asking about other countries before. So many Western European countries, which we often hold up as paragons of public health, they did not mandate vaccination for children, COVID vaccination. Why? Because we knew early on in the pandemic that children are less likely to get COVID, that if they do get COVID, it's likely to be mild, and they're less likely to transmit it. We also realized that any intervention, medical intervention, any vaccine is going to have some side effects, even though it's small, that the risks of the vaccine might have outweighed the benefit of vaccinating those children. Now, I actually think that whether or not children should have been vaccinated is a subject around which reasonable people can differ. And I mentioned in the book that we have two children, both of whom we got vaccinated for COVID. In my mind, it was well worth it. My concern, though, is that we never had that conversation. My concern is that we lean so heavily into saying everybody has to be vaccinated, forget about including children. And I think it's true, the imposition of those kind of narrower-minded approaches than we should have taken, that we ended up losing trust, because people know that when we're doing these things, that ultimately the science is not as clear as we're making it out to be, that there should be more space for individual autonomy. So we pushed way too far, and that lost us trust. If I go back to just being concrete again with my metaphor that I started at the beginning, it's a little bit like a law came down tomorrow that said, look, there's more of a risk in driving in your car. Everybody who's in their car needs to wear a helmet tomorrow. And because there's risk. To which people, what would happen if that happened tomorrow? There would be people say, forget about this. This is silly. I don't want to do that, right? So we misread our mandate to create a better world through science-informed, non-ideological approaches that respect the autonomy of individuals, that move us to gradually a better world, one that brings everybody along.
On that point, where we respect other people's points of view and so on, two things. In the very beginning there, under President Trump, there was a total disregard for vaccination for any kind of thing. The other one is preceding by some years the whole COVID issue. There's been an anti-vax problem in this country anyway for the normal childhood vaccinations. And so when reading your book, I was wanting to ask you, well, how would you deal with that? Because in both cases, it subjected the general public to really serious health issues, you see, and that still exists with the anti-vax crowd for the childhood vaccinations and maybe the COVID thing too. How do you handle that in a reasonable fashion?
Yeah, so thank you for bringing those up. So I think there are three different issues that you're raising, and if I may, let me just try to take them apart. Let me start with Trump, because and I want to be very careful. Whenever I address Trump, I'm always worried that people are going to immediately say, what are you being a Democrat because you're criticizing Trump? So I'm trying to really be dispassionate and analyze what happened. There was a president at the time, President Trump, who was openly hostile to the idea that COVID even existed, essentially, to things like vaccines to help COVID, promoting non-treatments as though they were treatment. And that made for a very difficult environment. And in many ways, what public health was doing was reacting to the provocation that was being set by the president. So it was a very difficult environment to navigate. And I have deep sympathy for that. So in some respects, I feel like you can't even have this conversation without starting with Trump and recognize that it was the antagonism of Trump that pushed public health into some of these liberal corners to begin with. So that's point A. Point B, in the context of vaccine resistance, okay? And I would divide that into two categories. I would divide it into one category, which is reasonable disagreement and bad faith actors. Let me start with the bad faith actors, because bad faith actors are almost easier to deal with. Bad faith actors are people who know better, but who are exploiting a situation to advance their own agenda. Be that agenda a partisan agenda, because I can rally up my base and they're going to come out with placards for me, or be that agenda something even as simple as getting likes in social media, because I'm going to say provocative things, and that's going to get people to follow me. So there are bad faith actors who create complexity in our conversation about whether we should vaccinate or not and who should vaccinate or not. And I have very little tolerance for bad faith actors, to be honest. And I actually think that we should push back with all our might. And I think we should push back with science, with reason, and with efforts to limit the influence and the penetrance into the public conversation of bad faith actors. So that's point two. The third point, though, is a harder point, which is good faith disagreement, a good faith weighing differently of the risks and the benefits. Things like vaccine ultimately are all about risks and benefits. And we as a society make a decision about that the risks are outweighed by the benefits of the vaccine. And for the vaccines that we require, childhood vaccinations, measles, mumps, rubella, diphtheria, pertussis, we have saved hundreds of millions of lives because the benefits of these vaccines far outweigh the risks. But there are risks, even though they are small. So there is this tension in that we need to struggle with as a society, where we need to bring people along. And here's the key. The key is bringing people along, and that takes time. In COVID, of course, we didn't have time. So it was difficult to bring people along. But we also need to recognize that the weighing of risks and the weighing of benefits, sometimes people acting in good faith, who are all trying to come up with the right answer, can disagree. And we need to have space for that. And one of the illiberal actions of public health is acting in COVID during COVID as though there was never any space for disagreement, acting in COVID as though the only answer was the simple answer of vaccines for everybody all the time. And that, I think, drove people away and created some of the mistrust that we're dealing with now.
If I may say so, I appreciated in your book that you brought up the issue of uncertainty, how we need to accept uncertainty, which is very much the scientific view. And we've come from a very long history where somebody, produces the orthodox answer of everything. That's what we follow. And so there was a lot of belief in the past, and much of it wrong-headed. But in science, when scientists are wrong, they say, okay, that was wrong, start over again. And scientists have to start over all the time. You brought this up. Can you say something about the importance of learning to deal with that, as to be in the liberal approach there, in the small
yeah, the small L liberal, yes, that's the term. Yeah. Thank you for bringing that up. I think, look, science is all about uncertainty. Right? I think there's a public misconception that science is all about these rigid rules. And I think it's because, we all learn physics of some sort in high school. And we remember, well, there's a coefficient of gravity and it's always the same. It's just how it is. But we forget that that's a very narrow part of science. Most science embeds uncertainty, and there are all sorts of complex factors that result in us not necessarily having a clear answer. The challenge in the context of a crisis like COVID is how to communicate that uncertainty. And we collectively leaned into not admitting to uncertainty. And that became really problematic. So, for example, at the beginning of the pandemic, everybody remembers the strongly worded messages that say, don't wear masks. Masks make no difference. You're wasting time. Definitely not. Then it shifted. Also, no, everybody has to wear a mask. Well, that kind of shift is entirely rational, by the way, because the science shifted, our understanding shifted. So that's fine. The problem wasn't the change. The problem was that we had communicated with such false certitude that then when we shifted, we lost confidence with people. We acted during COVID in a way that suggested that the people couldn't handle the truth if the truth was complex. We acted through a lens that said, in an emergency, people need to hear certainty. They needed to hear the sort of captain of the ship saying, the right answer is this, everybody follow me. But the world has shifted, and that's not the case. People can handle the truth. People need to handle uncertainty. People need to be told, here's what we know, here's what we don't know. Based on our best judgment right now, what we should do is X. But we may get back to you tomorrow with different feedback if the answer is Y. Now, from a place of empathy with the challenge that public health faced, we need to recognize that this was unfolding in a time of antagonism from the person with the most loudest bullhorn in the room, the president. And also, it was unfolding in a time of where social media was dominating the public conversation. And it was a new medium that we did not know how to deal with. And social media rewards false certitude, right? Social media doesn't really reward you saying, well, the answer today is probably this, but there's a whole list of caveats and the answer may change tomorrow. No, what social media rewards is everybody do this. And that is what social media rewards. So we did not know how to navigate that communication medium. Look, the good news in all this is that we're having this conversation. The good news, Yvonne, is that you and I are talking about this, that other people are talking about this, and that I'm an optimist at heart. And in the next pandemic, we will be better at this.
Yes, I hope so. And you brought up just now the social media issue, which really did a lot of shaping of the issues, the problems that we had here. But in your book, I would just like to say to the audience that you bring up the good and the bad there. They can go both ways, but that there are many positive aspects of social media in terms of being able to communicate with friends and family and that sort of thing. And then there is this other problem of misinformation, disinformation that is well worth considering. And I wish we had more time for that. Unfortunately, we have to switch now to get the questions in, if that would be all right. We probably should have covered the book a little more than that, but maybe it will come up in the questions. But people, here's his book again. But this conversation was meant to be more comprehensive, especially to get at the issue of public health and then health care. Dr. Galea, I'm going to switch off to the questions now, if I may, and before we say goodbye, and thank you for all this very good information. Meanwhile, I want to start with this one that just came in because this is important in general. This question is, I believe the issue of tobacco control serves as a good example of how health protections can improve over time. And I think you'll agree it took nearly 50 years of hard work, but it's still out there for sure. But it seems it's even more difficult now to bring about positive change on issues like food, nutrition, so on. Could you comment?
Yeah. I suppose I'm not sure that it's more difficult now. I think it's difficult. I think it took 50 years. The question is correct. It took 50 years to bring us to a place where we take seatbelts and airbags and shatterproof glass at face value, when we don't second guess them. Tobacco is another one. I mean, it took 60 years to get to a place where really the prevalence of tobacco smoking is quite low in this country. It takes time to get people to change how they think. And our job in public health, and anybody whose job it is to generate the society that creates health, is to change how we think about things. One of my earlier books was called Well, but the subtitle of that book was What We Need to Talk About When We Talk About Health. Because I was trying to inject in our conversation these elements, Yvonne, that you and I are talking about now. As I see it, it's by injecting these elements in the conversation is how we then get the proverbial kitchen table conversation to move away from just let's talk about our doctors, to talk about safe environment, safe working conditions, livable wages, gender equity, a world free from violence, a world where people are not lonely. And those are the elements that generate health.
Okay. Another question. What are the top U.S. health and human services policies that need the most work at this time?
Oh, well, I'm not sure I know how to answer that because a lot of things need a lot of work. My answer to
Where to start, right?
yeah, well, my answer to the question is generally very pragmatic. I
Mhm.
think a number of things can make a difference, and I would like to see us work at the intersection of what should be and what can be. And there are different jurisdictions where different policies are feasible. For example, early childhood education is a real positive if we can actually have a better educated society for decades to come. In some jurisdictions, that's possible, some not. I have written about the need for there to be efforts to narrow income and wealth gaps. And through efforts, for example, like reparations for Black American slavery. Some jurisdictions that's possible, some jurisdictions that's not. So I'm all for the pragmatic effort to do what's possible where it's possible. Because at the end of the day, it's a little bit like Swiss cheese, right? You have what you want is one slice with holes in a particular place, another slice with holes in a different place, so you're covering up the holes, right? So you build up enough that you capture all the challenges. And to do that, you need layer upon layer upon layer upon layer of decision making and of policy making in different jurisdictions.
Thank you. Next one, is the U.S. government handling the COVID-19 pandemic follow-up well enough? And do we have systems in place for future pandemics?
I think there are quite a few efforts that are in place to improve our tangible efforts in creating systems to detect, to monitor, to mitigate the transmission of a novel infectious disease, which ultimately leads to a pandemic. What I worry about is much less effort being made to change the foundational forces that generate health, to change the structures that you and I have talked about a healthier world, a better world, a world where everybody is safer, where everybody can thrive, where everybody can actually self-actualize and live with dignity so that everybody can be healthy for as long as possible. Those are the elements that I worry we're not investing enough in.
Right. Okay. Another one, Houston now offers street medicine for the homeless. Patients are treated on the street, not in clinics and so on. What do you have to say about programs like this? And are there other programs of that sort? Is that a good idea?
Yeah, I do think that's a good idea. I think there are a range of programs of that sort, and I think that we should never turn our noses at innovative local service projects that aim to do good for people who need it. For anybody who's interested, who's listening, I do a blog roughly weekly or every 2
Yes.
called The Healthiest Goldfish, and you can sign up for it. It's free. And just this weekend, I wrote a piece about balancing and respecting the need for local service work in innovative ways to generate health. Not everything we do can be about the big foundational policy. Some of it has to be about the work that needs to be done today on the ground for people who actually need it. So I think efforts like that are important and admirable.
Yes. Just on that issue, the offering stuff sort of on the street, these kinds of remedies. I had a discussion recently with somebody about the drug addiction. What are they, like little mini buses that go around and treat people right there on the street? I guess, or they can take the drug, but under safe conditions. Is that something that is recommended? Do you think that that's a good idea? In other words, it's a more protected environment, but this person knew a lot about it and had questions about whether that was going to solve the drug problem.
Well, I don't know what the word solve. Solve is a very big
Mm,
word, but I
mm,
do know that there is a significant shift in our thinking, in our health thinking right now, to engaging communities more, to taking services to communities to where they're needed. And I think insofar as these efforts go to places where people with substance dependence problems are, I think that's a good thing. And I actually think that again, those who are behind these efforts are to be lauded. There are good people doing a lot of good work under difficult circumstances, and those are my heroes.
Okay. A question just came that this is really important. Texas just turned down this $350 million in federal money to feed children during the summer. And I think many people have been concerned about that. When this person says, what arguments can I use when I talk to my legislators?
Yes, yes. Yeah, unfortunately, in many states in this country that have for ideological reasons turned down resources that are practically helpful, that are obviously helpful to them. And I think the argument is we should all be on the side of healthy children, and we should do whatever we can do to make that the case. And if Texas is going to turn down federal money, then Texas should be held in the hot seat to put up its own money to deal with these issues. Because, I've often found the health of our children is a unifying glue. Everybody wants their children to be healthy. Everybody should want their children to be healthy. It is the right thing. It doesn't matter what our identity is. We want our children to be healthy. And that means that we as a society should be willing to invest our money and our effort in creating the structures that make children healthy.
Yes, and that reminds me that it is in this country, and I don't know if other countries talk about it like this way, but that Texas is one of the states where you have this push for right to life rather than right to a life. So you get the right to life up until the time you're born, and then, then not having these safeguards to help children develop and so on is a problem. Do you know if that's peculiar to us, this great emphasis on that has come back?
Well, I think these issues get very freighted politically in this country, particularly around reproductive rights and rights to abortion. So it gets very complicated very quickly. I think what we're talking about, you and I, is on our moral imperative, and I see Megan has shared a piece I wrote about moral imperatives, to do everything we can to create a world that generates health for as many people as possible. And I see that as an important mission.
Right. It is an important mission, and we have to close down now, but I need to say thank you so much for giving your expertise and your time today. Keep writing. I will put on our event page the healthiest goldfish. I'm a subscriber, so I will attest to that. That's very good information all the time. And thank you for your efforts for outreach to the public very much.
Thank you for all everything you do, Yvonne. I really admire what you do, and thank you for having me on and engaging this conversation. I'm very grateful to you.
Thank you. Goodbye now.